System audio lecture. So in this one, we're going to look at kind of the generalities of the peripheral nervous system. And again, you're looking at anything that's coming off of the brain and the spinal cord and all the nerves that are going to all the different parts of the body. And in part one, we're going to look at mostly the cranial nerves, which are the nerves that are going to come off of your brain. Okay, so here's just the basic info of the peripheral nervous system. And again, we've kind of touched on a bunch of these, but we just want to kind of summarize again. But it includes all the neural structures outside of the brain and the spinal cord. So these are all my receptors, right? My sensory receptors, peripheral nerves, ganglia, efferent motor nerve endings. It's going to provide the link to and from the outside world. So again, I'm bringing information to my central nervous system so they can be analyzed. My brain is deciding what to do, and then it's trying to control and sort of make changes. And it's going to do this through these impulses that are going to travel through this peripheral nervous system. Okay, so link to and from the outside world. The nerves are going to thread through virtually every part of the body. And again, it's enabling my central nervous system to receive information from all these receptors. And then it's also going to enable it to sort of carry out its decisions by stimulating those effectors. Okay, so my sensory receptors and sensation. So we have sensory receptors, and we want to just look at what exactly are these receptors. But they're going to be specialized receptors. They're going to respond to specific stimuli or changes in their environment, and we're going to have a bunch of different types that we're going to look at in a second. But the activation of a sensory receptor by an adequate stimulus, because again, not every stimulus is going to turn into this action potential or send information up to the brain. This is where we go back to those chapters where we talked about that threshold, and I have to get enough stimulation to sort of send these impulses along these nerves. Okay, but what they're going to do is they're going to stimulate or create these graded potentials. Okay, and then the graded potentials are going to trigger nerve impulses, and again, they're going to get sent afferently along this peripheral nervous system fibers. And again, if it's afferent, that means that they're traveling towards the central nervous system. And again, all the impulses from my receptors are going to go towards my central nervous system. But again, I need enough stimulation. Your body doesn't have time to kind of pay attention to everything. It takes that certain amount of stimulation to sort of create those action potentials to send that impulse kind of up to the brain. Okay, so here are two important definitions, and again, these are good for multiple choice questions, but you have sensation and perception, and a lot of times we're going to kind of combine these, but there's just a very small kind of difference here. Okay, sensation is just the awareness of the stimulus, or that you actually feel something. Okay, you just feel it. Okay, and then perception is going to be where I give that stimulus a specific type of meaning, or it's the interpretation of that stimulus. Okay, so just a real tricky one where sometimes we link them together, but we want to make sure that that sensation is just the awareness of the stimulus, and the perception is when I'm sort of interpreting what that stimulus is going to kind of mean. So we can classify all these sensory receptors in a bunch of different ways. We can classify them by the type of stimulus they detect. Again, those are going to be really good multiple choice questions. We can classify them by their location in the body, and then we can classify them by their structural complexity. And we're just going to look at each one of these kind of really quickly. Okay, but I get all these different types of classifications based on their stimulus type. And again, you want to make sure that you know that these are the five. So I have mechanoreceptors, I have thermoreceptors, I have photoreceptors, chemoreceptors, and then I have these nociceptors. And some of these we can kind of already know what they're going to sort of be stimulated by, right? So thermo is going to be temperature, photo is going to be some sort of light, chemoreceptors are going to be some sort of chemical. We've already talked a little bit about mechanoreceptors, but we just want to break down, okay, what are each of these types of receptors going to sort of monitor for me, okay? So mechanoreceptors are responding to mechanical force, and by this they mean touch, pressure, vibration, stretch, okay? Thermoreceptors are, again, temperature. Photoreceptors are going to be light. My chemoreceptors are going to respond to chemicals, and again, this can be smell, taste, things that are going on in your blood or the different fluids in your body. And then this is always a big question too, is that these nociceptors, and they're going to be the ones that are going to respond to pain, okay? So anything that's potentially damaging, excessive heat, cold, excessive pressure, excessive chemicals that are kind of dangerous to the body are all going to be, they're going to stimulate these nociceptors, okay? So again, good multiple choice questions just to know the five types of receptors and to know what sort of stimuli they're monitoring for us. Okay, we can also classify things by location. This one's pretty easy. So we have exteroreceptors, we have interoceptors, and then we have proprioceptors. And again, we want to start to be able to sort of break down words, and we want to be like, okay, extero, what does that mean throughout all the other chapters? It's probably going to mean that it's a little more external or a little more things coming from the outside of the body. Intero is going to be more internally. So we want to start to just sort of use all that terminology that we've learned too far to kind of guess at sort of, what the terms mean before we actually look at the definitions. So exteroreceptors are, again, sensitive to stimuli arising from outside of the body. This kind of tricks people kind of sometimes too, but most of these are going to be near the body surface. They're including touch, pressure, pain, temperature, receptors of the skin. And this is the part that can be a little bit tricky, is this they account for the receptors of our special senses. So you want to remember that all this, everything that you're seeing, everything that you're hearing, everything that you're smelling and tasting are things that are coming from, again, outside the body. Okay, so even though you eat stuff and you smell stuff and it comes internally, they're originating from outside. So they're going to be exteroreceptors. Okay, interoceptors are going to be stimuli within the body. So this is internal viscera or organs, blood vessels. They're monitoring a bunch of things inside the body. So chemical changes, tissue stretch, temperature. They can activate feelings of pain, discomfort, hunger, thirst. But again, within the body, okay? And usually these are things that we're just kind of unaware of until they get to a certain point, and then your body's going to tell you, hey, you're thirsty, you're hungry, these different kinds of things, okay? But again, just we want to concentrate on just the basic definition. Proprioceptors, again, we've mentioned a little bit. They're also going to respond to this internal stimuli, but it's mostly these positions and what's going on with your skeletal muscles, tendons, joints, ligaments, connective tissue coverings, your bones, your muscles. And what they're going to do is they're going to advise your body of your movements all the time and sort of what positions your body and your joints are kind of in. So they're monitoring the stretch in all these tissues, or structures. And again, they're helping you keep your balance and sort of know exactly what muscles need to be turned off and what you need to be doing to sort of maintain these positions at any other time. Okay, and they're going to also let you know if your joints are getting into positions that might sort of put you in a little bit of danger too. Okay, and then these are great ones because I can practice these and I can get better at my balance and my speed of ability to sort of, most people, when you talk about people that get injured all the time, a lot of people talk about, they're not strong enough, but it's actually, a lot of times it's not that you're not strong enough, it's just that you're not able to respond quickly. And what you can do is sort of train this ability of your body to sort of respond to these changes that are going on in the environment and kind of within your joints a little bit quicker. And that is really the key to sort of keeping someone healthy. We also have classification by structure, and so we have 2 points, which are my general senses. Again, these are a lot of the things we just talked about. So monitoring general sensory info found throughout the body. So temperature, pain, touch, pressure, vibration. We talked about proprioception, and then we have special senses, which again are going to be very, very specific to certain organs. So we have my vision, my hearing, my equilibrium or my balance, smell, taste, and again, these special senses are going to be housed in these little sensory organs. We're going to have specific kind of sensors that are going to do these things kind of for us. So we get to look at our special senses kind of more towards the end of this unit. So here is my peripheral system nerves. And again, one of the mistakes that people make is they think because the cranial nerves are coming off of the brain, they're going to be part of that central nervous system. But you want to just remember that those cranial nerves and all my branches off my spinal cord are going to be part of this peripheral nervous system. And again, in part one, we're just going to look at the cranial nerves, and we're going to show you a little, kind of like a little test that you can do at home with your brother or sister, or your girlfriend or your boyfriend, or your mom or your dad, just to kind of help you remember what each of these nerves kind of does for us. Okay, so we have to be able to label these. Okay, so if we give you the picture of the brain upside down, so this is your brain upside down, and I want to kind of be able to label all these 12 cranial nerves, and then we have to know sort of what the function of each of these is. And again, we're going to look at how we would test these and how that's going to kind of help you remember what their job is in the body. Okay, and again, they're sending information to certain parts of the brain so that it can be analyzed, and so my brain knows exactly what's kind of going on with my head and my neck all the time. Okay, so we have 12 pairs of cranial nerves. You need to know their name. You need to know the number, because a lot of times some questions are like, if I had a deficit in cranial nerve number 7, what is that person going to be unable to do, or what are they going to experience? Or sometimes the questions might give you the name. So this is where I want to make sure that I can just write down 1 to 12, and I can put the name beside the number, and I can just, again, kind of put that function in there a little bit too. And then for my practical, again, we're just identifying things, but I want to be able to make sure that I can label them on the pictures of the brain. So here is our picture of the brain here. And again, you want to kind of do these things in order, and I always kind of start at the front part here, and then they kind of go in a little order where they're going to go down the middle, right? So I have my olfactory, I have my optic nerve, I have this oculomotor, and then I move out to the trochlear, I go to the trigeminal. The trick, once you get to the trigeminal, you have to kind of come back to the center, And then I always used to go down the side and then come up to number 12, kind of right on the top of your little brainstem and sort of back part of the brain there a little bit, okay? But it's one of those things where I just want to make sure that I practice labeling this picture, especially for your practical, just over and over and over until, when it shows up on my practical, I'm familiar with it. It just makes it much, much, much easier, okay? So make sure you know these really, really well by their number and their name, because they're for sure going to end up on your test. And then now we're going to look at sort of what each one of these does, and you can tell by the names. Sometimes the names kind of tells you what the function of the nerve is kind of going to be, or what sort of information it's going to send. So here is another little chart, and it kind of shows you a little bit of just what the basic function is, and it's also telling you, do they have a sensory and a motor function. So some of these are going to send sensory information. Some of them are only going to do motor stuff, where they're firing muscles and doing things like that. Some of them are going to do both. So we want to know just what, again, the general function of each one of these nerves is going to be once we get that ability to kind of label them. And here's just the basic kind of sensory or just summary of what they do. And again, olfactory is going to be smell, optics can be vision, and again, we're going to look at these a little bit more independently and just a little more specifically in just a little bit, okay? But again, know the name, know the number, and then we want to know, again, do they have a sensory function, do they have a motor function, and then what is each one of those kind of sensory or those motor functions. Okay, so you got 12 things that you got to kind of memorize here. And then here are just the basic functions of each. So olfactory is going to be smell. Optic is going to be vision. Oculomotor, ocular always means eye, so this is going to be motor to the eye, so that's going to be eye muscles. I have a bunch of these cranial nerves, I do my eye muscles. So trochlear, abducens are going to be eye muscles. Trigeminal is a big one because it's really common for people to get these neuralgias, and they'll get, again, what they call trigeminal neuralgia, and they'll get these specific sort of symptoms on the one side of their face versus the other, but this is going to be sensory to my face. It's also going to be involved in my motor or my muscles for chewing. We're going to have our facial nerve, which is going to be our muscles of facial expression, so smiling, frowning, etc. Vestibulocochlear is going to, anytime you see cochlear, the vestibule, we're going to look at again when we get to the special senses chapter, but it's going to be hearing, balance. Glossopharyngeal is going to be innervating my tongue and my pharynx, or we're getting more towards the throat. My vagus nerve is going to be swallowing, and again, we're going to look at these a little more specifically in a second here. Accessory is just going to kind of help my vagus nerve and do, one or two other things for me. Hypoglossal is going to be my tongue muscles, and again, we're going to look at kind of how we would kind of test each of these, and it's really the best way to sort of go through and kind of test them, and then what you'll do is you'll remember sort of, okay, how did I test number 12? How did I test number 7? How did I test number 8 or 9? And it'll make it much, much easier for you to kind of remember, okay? This is how we used to memorize them in chiropractic school. So you get this: on occasion, our trusty truck acts funny. Very good vehicle anyhow. Okay, and there's a bunch of these on the internet that you can kind of take, and the more inappropriate or the funnier they are, the easier they are to remember. But the first letter of each word gives you the first letter of the optic nerve that you're talking about. Okay, so it's just an easy way, a mnemonic to kind of help you be like, okay, what's number 7, what's number 8, what's number 9, what's number 10. So it'll give you that first letter, and then from there we should be able to sort of link them all together. Okay. So here is your olfactory, and again, these are just really, really specific, but they just kind of show you where they're located, okay? So they show the olfactory coming off of the brain here and kind of working through this little wall and kind of getting into your nasal cavity. And again, we're going to look at the functions, but more so when we do our little tests here, okay? I can see my optic nerves. We're going to come back to that a little bit more when we talk about our vision. You get your oculomotor, again, eye muscles, okay? Trochlear, eye muscles. Trigeminal is a little different, so I get sensory, right? And then I get motor to my jaw, so you get sensory to the face, motor to my jaw muscles. Okay, you get your abducens, which again is an eye muscle one. You get your facial nerve. The trigeminal and the facial nerves are the ones that people mix up all the time. Okay, so trigeminal, again, is sensory to the face. So can I feel sensations, on my face? And again, motor to the jaw. The facial nerve is the one that's going to do my motor to my face. So that's my smiling, my frowning, my moving all the muscles in my face around. You can also get some nerve injuries and things like that with the facial nerve, where people will have, kind of one side of their face that won't kind of work anymore. We'll come back and talk about that in a little bit too. And then this one's going to have a sensory function too, but it's going to be more sensory to my tongue, or it's going to do part of my taste, okay? So there's your facial nerve. Vestibulocochlear, okay, it's going to be in your ears, so it's going to be my hearing and my balance. And we know that our ears play a big role in our balance, because we know if we get a really bad ear infection, it can make you where you can be a little more wobbly, okay? So a lot of these things, again, we can kind of piece it together a little bit. Glossopharyngeal, so this is my tongue, swallowing. Salivary glands is going to do the other part of my taste for me. You get your vagus nerve, and with the vagus, you always want to think about the organs. So it's sensory and motor to all your organs, okay? And then I get my accessory nerve. It's going to be my neck muscles for me. And then we get the hypoglossal, which is going to be my tongue muscles, okay? And then again, we're going to look at a way where we can kind of do a little test at home. And if we were in lab, we would kind of do this on each other. But it's good, again, to just kind of do it at home with a partner. And again, it'll just help you kind of just remember everything a little bit better, okay? So the best way to remember this is to kind of do this little cranial nerve test, okay? So you're going to need a helper. You need a couple paper cups. You're going to have a little bit of coffee, a little bit of cinnamon. You can kind of work through the list here. But again, it's going to allow us to kind of test each one of these nerves and then help us to remember what we have to know for our test. Okay, so here's your little sheet. Okay, so this is a way to test all your cranial nerves. So we look at number one, which is olfactory, and we know it's smell. So we're going to take 2 cups, and then with your partner, you have to have them close their eyes, okay? Because people can kind of see what's in the cup. So with this one, you want to have the cup set up. One's going to have, some distinctive kind of smell. Most people use cinnamon and coffee because they're just very easy to kind of find. But I'm going to have the cups over set off to the side. You're going to have somebody sitting in a chair. You're going to have them close their eyes. You're not going to tell them what you're bringing up to their nose, but you're just going to bring the cup up to their nose, have them smell, see if they can tell you sort of what they're smelling. One of the best things you can do is just bring a cup up and don't have anything in there. And then you can see if people are kind of trying to cheat, because people will kind of try to cheat and sort of just guess at what you're putting in front of them, okay? So olfactory is an easy one. Optic nerve is going to be, again, my vision, right? So this one we're using the Snellen chart, and you can go online and kind of print those out on a piece of paper. And this is what you're going to see kind of when you go to the eye doctor and they kind of put the chart up on the wall and they're looking to see, what line of letter can I kind of use. And again, with this one, you're kind of using, you have to focus your eyes and you have to do all these different little things, but you're going to test this optic nerve by just seeing if the person can read. And on the Snellen chart, it's going to have little numbers on there, and it's going to say, okay, this is the line that you should be able to read if you're standing 10 feet or 15 or 20 feet away. Okay, so it'll have the 20, 20, 15, 15. It'll have all those different little numbers on there. But you want to look at the chart on the side and kind of see, okay, what line should I be able to read if I'm standing a certain distance away. Number 3. Okay, so we get our oculomotor, we get our trochlear nerve, and we get our abducens nerves. And again, these ones are all going to be the muscles to my eyes. Okay, so this one is, we're going to do 2 different things. You're going to kind of hold your finger up, where you can hold like a light pen or just a pencil, and what you're going to do is put it in front of the person's eyes, about maybe a foot away or 6 inches away from their nose, and then you're just going to ask them to kind of follow your finger or follow the pen or the pen light. Now they're not moving their head, right? They're just following it with their eyes, and what you're going to do is move it to the side, move it up, move it down, come back to center, do the same thing on the other side. And what you're doing to watch, or what you're trying to sort of watch, is if they can follow that finger or that pen really, really smoothly with their eye muscles. And what you'll find is some people have some little deficits if they have some other things kind of going on, where they'll have trouble on one side versus the other side. The other thing you're going to check, and this is one of the cool things to kind of check, is going to be this pupillary response. And we've all seen these if you watch any of the doctor shows where someone gets a head trauma and they shine the pen light into their eyes, and what they're looking for is to see if their pupil is going to sort of constrict and if it's going to kind of dilate. For this one, you want to be in a dark room and you want to have a little pen light or like a little mini flashlight, and what you want to do is be in the dark room, you want to keep the light behind them, and then you want to just quickly bring that light into their eye. Okay, and what's going to happen is in the dark, your pupils are going to dilate because they're trying to bring as much light as possible kind of into the eye. And when you shine that light in there, that pupil is going to get really, really small, because again, my eye is going to try to control the amount of light that can kind of come into the eye. But you'll be amazed, especially if you're in a really, really dark room, just how much your pupil can kind of dilate and how much it'll constrict or how small it'll get when you shine that light in there. Okay. Trigeminal nerve, again, has both sensory and motor functions. So to test the motor part, you can take, for this one there, usually you would do like a popsicle stick or something like that, and you would have the person kind of bite down, and then you're just going to gently try to kind of pull the stick from their mouth and see if they can kind of keep you from pulling the stick out. So that's a good way to sort of test the motor function. The other part of the trigeminal is the sensation, okay, to the sides of the face, and this is just light touch. You can take a cotton ball, you can take a Q-tip, you can take your finger and just kind of brush the side of their face, and all the, on their cheek, a little bit above the cheek, a little bit more towards the jaw, and you're just looking to see if they can just feel that sensation. And again, they would have their eyes closed at this point, okay? Facial nerve is a really easy one because, again, I'm going to just have someone, I'm going to see if they can smile, if they can frown, if they can make funny faces. And then you can also test their taste on, this should say, the front part of their tongue. So you can take something salty, a little water with some salt in there, a little bit of water with some sugar in there, and you can just put a drop of it on the front part of their tongue and see if they can taste it. Okay? And they can tell the difference between sort of salty versus sweet. Vestibulocochlear is hearing and balance. So in this one, they only do the hearing portion. Okay, and you can tell that this test is pretty old because they talk in here about this ticking of a clock or a stopwatch. Most people don't have ticking watches anymore. But what you can do is just take 2 pieces of paper and you can put them on kind of in between your fingers, and you can just start your hand kind of really far away from behind someone, have them close their eyes again, you don't want them to be able to see what you're doing, and then just slowly sort of bring it closer and closer to their ears, and they're going to just tell you, okay, when they can kind of start to hear the sound. Okay, if you have a watch that ticks or you have something similar to that that just makes a really quiet kind of noise, you can use that too. And again, you're going to kind of monitor, how they can hear from left side versus the right side. Balance is also really easy to check, but in this one, you're always worried about somebody kind of falling. So anytime you're testing someone's balance, you want to have it where they have something to grab onto if they need to, because a lot of times you're not expecting them to have problems, but as soon as you have them kind of close their eyes and you make them do something a little bit trickier, sometimes people will lose their balance really, really quickly. Glossopharyngeal and the vagus nerve, you're going to have your partner drink some water, and you're just going to watch to see how they swallow. Okay, and then the glossopharyngeal nerve is going to be responsible for taste on the back part of your tongue. And this is where, again, you can take the salty or the sugar water, and this time, again, you're going to put it on the back part of the tongue, and you're going to see if they can taste it. Spinal accessory is going to test the strength of the muscles used in head movements. So you're going to take your hands, put them on the side of your partner's head, and you're just going to have them sort of push from side to side and push their head sort of into your hands and see if you can feel a little bit of pressure on there. Hypoglossal is, again, another easy one where you're going to have them stick their tongue out, have them move it side to side, and again, you're just looking to see if they can fire these tongue muscles kind of equally from side to side. Okay, so go through this with somebody. I promise you, this is really going to help you on your test if you can kind of be like, okay, how did I test this nerve? What did I do for this nerve? You're going to remember it much, much better than if you just kind of blindly try to kind of memorize everything. Okay? All right, so other tests you'll see, especially when you go to the doctor, everyone's had their patellar reflex kind of checked, or you have your bicep reflex, Achilles reflex. We're also going to look at dermatomes here in a second. So here's my patellar reflex. This is the one you'll kind of see all the time. The trick with all these is, you're basically just hitting this tendon with that little hammer, and what you're doing is you're just putting a very quick little stretch into that tendon, and you're stretching that muscle, and then what's going to happen is my body is going to kind of fire this muscle, and it's basically trying to kind of keep that muscle from getting kind of damaged. Okay, so if you have a nice doctor, they're going to kind of put their finger over the tendon, and then they're going to tap on it with the hammer. If you have a not so nice doctor, they'll just kind of whack you with that hammer. But you also want to, if you see in the picture, he's standing to the side. Some people have some really extreme reflexes where they're not going to do it on purpose, but when you hit that tendon, they're going to straighten their leg really, really fast. And if you're standing in front of them, it's really common that you're going to kind of get kicked. Okay, but this is probably the one that most people are familiar with. Okay, bicep, you can do the same thing. The other trick with all of these is you really have to have the arm or the leg just completely relaxed. So if you look at this one, you can see where they're sitting with their leg off the table, and that's just so that they can turn off their quadricep and their hamstring, because if the muscle is active, the reflexes don't work as well. Okay, so bicep, same thing. You have to biceps an easy one to find. Right in the elbow, you can just feel this big, huge tendon. If you have someone kind of curl up into your arm, that tendon will really kind of pop out, and what you're going to do is put your thumb on there, tap your thumb with the hammer, and what they're going to do is they're going to kind of bend their elbow really quickly, and you'll kind of see that bicep muscle kind of fire. Achilles is another easy one, so they can sit, their legs are hanging off the table again. You're going to move the foot into dorsiflexion, so you're just going to really, again, they're just relaxing. You're just pushing on the ball of their foot, moving their ankle into dorsiflexion. You're going to tap on the back of that Achilles, and what will happen is that they'll push their foot down into plantar flexion, okay? So they'll point their toe towards the floor. And these are, again, you can do these with any tendon, but these are the ones that are just the easiest to kind of get to, okay? So cool to kind of try and see if you can get to elicit. Some people have, again, really active reflexes. Some people you really have to try, or they're much, much, much less active or prevalent. Okay? Dermatomes are, what you're basically doing with dermatomes is you're looking at sensation to all these different parts of the body, and what they've basically done is kind of mapped out kind of where these nerves are originating from. So you can see in the picture kind of each level says like T3, T4, T5, C2, C3. They're basically telling you what nerve or what part of the spine the nerve is coming from that kind of innervates this part of the body. And the reason this is important, especially with chiropractic, with like my job, is that people will come in and they'll say, hey, I have a lot of numbness and tingling in this specific area. And what the dermatomes allow you to do is say, hey, if I have some numbness and tingling, especially with back pain, they get some numbness and tingling in the front part of their thigh, I can trace that back to what level of their lower back is that nerve kind of coming from. And a lot of times it's going to tell you sort of what areas you should be looking at for any sort of dysfunction or pain or sort of irritation. Okay, so pain into the front part of the leg is going to be that upper part of your lower back. If it's going right down the back of the leg, then you know it's coming from kind of lower down, more by your sacrum or that lower part of your back. Okay, but with this one, you can test soft touch, again with the cotton ball or Q-tip. You can take a toothpick and just real gently kind of put the toothpick on their arm and see if they can sense something that's a little sharper. You can do tuning forks with vibration. You do have to kind of do all of these, because what you will find is that some people will only be kind of lacking one of these, right? They can feel soft touch, they can feel sharpness, but they can't feel vibration. And some of these are, again, with any sort of deficit, some of these are the very, very first things that'll kind of pop up and let you know that they're sort of having problems in specific areas. Okay, so that's it for part one of the peripheral nervous system. In the second part, we're going to look at all the nerves that come off of the spinal cord and go to all the other parts of the body. And then we'll start moving into the autonomic nervous system, and then we'll start looking at the special senses.